In Agawam this morning, Behavioral Health Network formally opened its new Youth Community Crisis Stabilization facility. 22 News reporter Heath Kalb took a tour of the building and has why officials see real value in how this center can be used.
Nick, representatives of Behavioral Health Network, local elected officials, and representatives of the Commonwealth all participated in the opening, and what they all told me was an exciting day. The Behavioral Health Network, in partnership with the Gandara Center, celebrated the grand opening of its new youth crisis program in Agawam Friday morning. Acknowledging a need for a facility like this in western Massachusetts, the two organizations built this facility to provide on-site short-term crisis stabilization, therapeutic intervention, and specialized programs in a secure site for children and adolescents.
So there's a lot of youth experiencing mental health crises that are boarding in the emergency departments, being hospitalized in beds, who could benefit from either a stabilization outside of the hospital or as a diversion from an emergency department visit.
And instead of being in a hospital, the youth here will not only receive care, but have specialized programming and fun like this playground. This new program replaces and is an upgrade of BHN's youth community-based acute treatment program that has been operating for the past 8 years in Springfield. The level of care will be similar to the old facility, but includes enhanced psychiatry and nursing capacity to help support children with complex psychiatric needs.
So we have a couple gaming rooms, a couple of therapeutic spaces for youth, classrooms, because the expectation, of course, is that kids are still receiving education while they're here. And so lots of just different treatment spaces designed to help.
And many more individuals will be able to be served in the new program. Up to 22 children and youth in specialized units for children 6 to 11 years old and 12 to 18 years old, so that the youth will be with their peers in an environment that feels safer and more like a home and less like a hospital. The center told me that they should be ready to take admissions in about 2 weeks, as they are currently finalizing staffing and setting up all of the bedrooms. Working for you live in studio, I'm Heath Kalb, 22 News.